disclaimer. Exercise is not without its risks, and this or any other exercise program may result in injury. We are unable to perform a physical assessment with you at this time, and therefore you take individual responsibility for your exercise program. When exercising at home, choose a clear space at a comfortable temperature and have drinking water available. Please wear loose, comfortable clothing and flat, non-slip supportive footwear. Only exercise if you are feeling well. During exercise, it is normal to feel slightly warm, slightly out of puff, experience light perspiration, feel your muscles working and your heart rate increasing. It is not normal to experience dizziness, palpitations, undue breathlessness or chest pain. In these instances, you should stop, rest and allow the symptoms to ease. Should they not ease, follow any guidance that you have been given and seek medical advice. If you experience pain in your joints or muscles, stop, check your position and try again. If the pain persists, seek medical advice. However, feeling that your muscles are working and slight soreness the next day after exercise is normal and shows that the muscles are working. Breathe normally throughout and try not to hold your breath. Patients who have undergone cardiac surgery, for example bypass or valve surgery, and have had their chest bone opened need to be careful with arm and chest exercises for 12 weeks to allow the bone to heal. Exercise within a comfortable range and avoid pushing, pulling and heavy lifting. Remember, moderate intensity exercise with a warm-up and cool-down is a safe and effective treatment for your heart. Only ever do what is comfortable for you and seek advice if you have any issues or concerns. The aim of this presentation is to copy the exercises that we would normally do in our cardiac rehabilitation class, so you're able to try them at home. Before starting, please ensure you have read the disclaimer for your safety. If at home you would normally use support to aid your balance, then please make sure that you have a chair, a sturdy chair available to hold on to should you require it. We are now about to start the warm-up. Please adopt a relaxed, upright posture, and we will start to march on the spot. All patients' capabilities are different, as is their ability. Please make sure you adopt a pace that is suitable for you. Some patients will be very comfortable in maintaining a faster pace. Other patients will need to do a much slower pace. For the purpose of this presentation, I will adopt a steady pace. If you feel comfortable, please bring in your arms. Relax your arms down and tap forward. And back to marching on the spot. Stand with your feet shoulder width apart and do a small squat down. If you need to hold on for your balance, then it's fine to do so. Some people will be able to do a deeper squat and some a small squat, depending on if you have any joint problems. Do not push into any physical discomfort. And back to marching on the spot. Again, bending your elbows up. And gently stretching forward. If you can keep your feet moving whilst moving your arms, we do encourage you to do this to help your blood pressure. And relax your arms down. We're now going to begin some basic stretches. Keep your weight gently from side to side and look around to the right. Back to the centre and to the other side. And back to the centre and march it out. Take your shoulders backwards in small circles. And forwards. Stretch your arms forward. Touch your shoulders and stretch above your head to where it's comfortable for you. And gently down. As previously, take your weight from side to side. Take your right arm across your body and ease it into your body as long as it's comfortable for you to do so. Relax your arms down and change arms. We aim to hold the stretch for around 5 seconds. And back to marching on the spot. Right hand to right shoulder, easing the elbow up to the ceiling, and if comfortable, give it a little stretch back. Relax your arm down and repeat with the other arm. And relax down. And back to marching on the spot. Moving now onto the trunk area. Take your hands to chest height, again weight from side to side, and gently turn to where it's comfortable for you. If it is comfortable, you can also stretch your arm out. And back to the centre, and to the other side. And back to the centre. And repeat that movement. And back to marching on the spot. Over to the side, back to the centre, and to the other side, and back to the centre, and repeat that movement. And back to marching on the spot. If you find the marching is causing any discomfort in your legs, then tap out. And back to marching on the spot. We're now moving on to the leg exercises. Tap forward and step back. Tap forward and step back. Again, if you need support, please hold on to the sturdy object nearby. Right leg forward, toes up to the ceiling, front leg straight. And if you have no back, hip or knee problems, you may want to look forward and ease forward. And change legs. And back to marching on the spot or tapping out, depending on what is comfortable for you. And now we step from side to side. Feet now shoulder width apart, taking your weight from side to side and leaving this out if you have any hip problems that are causing discomfort. Over to the right and hold it there. Back to the centre and to the other side. And back to marching on the spot. Bringing your arms in and increasing the pace if you find it comfortable, but keeping to a steady pace if not. The next exercise is a lunge exercise. Please hold on if you need to. Step forward and step back. Step forward and step back. Hold on to aid your balance if you require this. Right leg forward and hold it there. Step back and change legs. Left leg forward, feet flat on the floor, heels on the floor, and hold it there. And back to marching on the spot. Please ensure you go at your own steady pace and the exercises are comfortable and you are breathing steadily. The last leg exercise is an exercise for your quads muscles, and you do need to hold on for this exercise. Hold on to the steady object, bend the knee to where it's comfortable. Some patients will be able to hold on to their foot or their trouser leg, but you only do that if it's safe for you to do so and it's easy for you to do so. And change legs. And back to marching on the spot. Patients who are finding that they are a little bit breathless may want to just slow the pace a little bit, but if you feel comfortable, stick to a steady pace, and many patients will want to pick up the pace. Tap forward. Tap into the side. And back to marching on the spot. If you feel comfortable, lifting the legs up a little bit and increasing the swing of your arms. If not, small movements are fine and low movements are fine. This depends on your ability and your condition. We are now about to start the circuit of exercises. We will do each exercise for 1 minute. At the end of the minute, you will hear a timer of bleeps that will indicate that we're moving to the next exercise. The first exercise is an arm exercise and it's bicep curls. If you don't have weights at home, please use tins of beans instead. If you can keep your feet moving, we encourage you to do so. If you are out of puff and you needed to sit, then you would be able to do that. Gently bend your arms up and slowly down, always taking your arms to where your joints find comfortable. As said, if you can keep your feet moving, then we encourage you to do that to help your blood pressure. The next exercise are step-ups. You would now march to the bottom step of your stairs at home, unless you have a step available as I have here. March to the step, stepping up and stepping down. Some patients, if they find that too difficult, will tap, or if they get a little bit out of puff, they can do this instead. Step up and step down. If you don't have a step at home or you live in a bungalow, you can change this exercise by doing a high knee. Again, if you need to, you can hold on. The next exercise we're going to perform is another arm exercise, and it's arm pull downs. You'll be given a piece of stretchy band to use. The start colour is yellow and resistance does go up in colours. Place one hand at the chest and one hand directly underneath. Gently keep the feet moving if you can. Pull down one hand away from the other. Try not to go too fast with the arms. And keep your breathing steady. And change arms. The next exercise is a leg exercise, and it's a lunge exercise. As we did in the stretches, step forward and step back. Step forward and step back. Please hold on to the steady object should you need to support your balance. Some patients may want to increase this exercise by holding on to the weights and doing a bigger movement. Again, do what is comfortable for you. The next exercise is an arm exercise, and it's outward raises. Again, we will need your weights or tins of beans for this exercise. Picking up the weights or your beans, keep your hands close to your body and your elbows tucked in. Gently take your arms away from your body to where is comfortable. If you have had bypass surgery or valve surgery performed, where your bone or your sternum has been opened, then the alternative for this exercise is to take your hands up to your chin. After 12 weeks, and if your sternum is feeling comfortable with no problems, you can start to gently go away from your body out to the side in a small movement. For all other patients, a slightly larger movement is fine as long as you do not have any neck or shoulder problems. The next exercise is a squat exercise. This is a leg exercise. Keep your feet moving and then feet shoulder width apart, and it's a small movement down. Again, hold on to the steady object should you require any support for your balance. If you'd like to do a slight march in between to give your legs a rest, then that is an option. Some patients will find a bigger movement is comfortable for them. Other patients will find a very small movement is comfortable for them. The next exercise is an arm exercise. Please grab your band again, and this time place it around the back and around the shoulder blades. Once around the shoulder blades, keep the feet gently moving if you can, and take your arms together and forward to where is comfortable. This is a chest press. Patients who are more capable are able to go quicker with the movement and keep the feet moving quicker. The next exercise is not suitable for all patients. If you want to leave this exercise out, that is fine, just keep marching, or you can do an alternative in the chair. The next exercise is sitting to standing from a chair. Sit and stand. Sit and stand. You can march in between to give yourself a little rest. If you have postural dizziness or hip, knee or back problems, you may want to adjust this exercise and either sit and do a straight leg raise in the chair, or do an alternative exercise such as marching. Else you can practice standing and sitting. The next exercise is an upright row. You can either do this with your weights or with your band. With your band, place the band underfoot. Stretch up to where it's comfortable, and a slight knee bend to finish, again to help your blood pressure. Stretch up, slight knee bend. Stretch up, slight knee bend. If you have knee problems and you're finding the bending is difficult, then stretch up and foot tap. But please be careful the band does not come out from under your foot. For other patients, a quicker movement is appropriate. This exercise with the tins or weights is gently stretching up with a quicker foot movement. The last exercise, exercise 10, is now marching on the spot to finish before we go into our cool down. Some patients will need to go slow, depending on your breathing and how you are feeling. Some patients will continue with a steady pace, and some patients will be doing a very brisk pace. We are now moving on to the cool down section. The cool down is the same as the warm up, but just at a slower pace. Keep the marching going, and we will then start our stretches. And tap forward. Back to marching on the spot. Keeping your feet shoulder width apart, a small squat. And back to marching on the spot. Tap forward. When ready, right leg forward, toes up to the ceiling, front leg straight. Hold on to a fixed object if need be. Keep your head forward. And if you have no back or hip or knee problems, lean forward. Hold it there. And change legs. And back to marching on the spot. Step forward and step back, step forward and step back. Again, holding on if you need a little bit of extra support. And hold your right leg there. Feet flat on the floor, facing forward and heels on the floor. Step back and change legs. And back to marching on the spot. Step to the side. Feet shoulder width apart, taking your weight gently from side to side and leaving this exercise out if you're finding you have any discomfort. Please leave any exercise out if it gives you discomfort. Over to the right and hold it there, back to the centre and to the other side. And back to marching on the spot. Holding on to the fixed object, bend your knee to where it's comfortable for you, holding on to your foot only if it's comfortable for you to do so. and change legs when you're ready. And back to marching on the spot, but slowing the pace slightly. Now moving up onto the trunk area, hands to chest height, weight from side to side, and when you're ready, gently around to the right and stretch back to where's comfortable for you. Back to the centre and to the other side. And back to the centre. And back to marching on the spot, or tapping out if you're finding your joints are becoming a little bit achy. When ready, feet shoulder width apart, gently over to the side, back to the centre, and to the other side, and back to the centre, and back to marching on the spot, or stepping out, and at a slightly slower pace. Take your shoulders backwards, and then forwards, and then feet shoulder width apart, gently transferring your weight from one side to the other as you take your arm across your body and easing it into your chest if it's comfortable for you to do so. And change arms. And tap out. Back to marching on the spot slowly. Right hand to right shoulder, easing the elbow up towards the ceiling and hold it there. And change arms. Left hand to left shoulder and easing up towards the ceiling. And gently down. Again, weight from side to side. Look around to the right, to where it's comfortable. Back to the centre. And to the other side. And back to the centre. Nice relaxed knees. Nice relaxed shoulders, and we finish with a nice deep breath. Deep breath in through your nose and out through your mouth. Exercise is safe and effective for your heart, but please remember you should only do what you are capable of doing and what is comfortable for you. Always make sure you have water available when you're exercising, and after exercise, get yourself a nice glass of water.